Good afternoon, everyone, and welcome to our Don't Get Bent Out of Shape Tips for Improved Musculoskeletal Health webinar brought to you by Excellus BlueCross BlueShield. I want to start out by thanking each of you for taking the time out of your day to join us here today for our June webinar, which is the sixth webinar part of our Excel Your Well webinar series that we launched in 2025 for our Excellus members. It is hard to believe that we are already almost halfway through the year, but we just wanted to stop, thank you, and once again recognize and appreciate all of you for attending any of the monthly well-being webinars that we facilitated this year. For those of you who have not attended, my name is Katie Keller-Burgess, and I am part of the well-being team here at Excellus. I will be the host for today's webinar, teeing up our guest speaker, Bill Sheehan, who will be presenting the majority of the content for today's webinar. So a few housekeeping items to start us off with here today. Please note that today's webinar and all of our 2025 wellbeing webinars are being recorded, and they are being housed on our Excellus BlueCross BlueShield YouTube page. So if you need to go back to this recording and or maybe access previous well-being webinars that you were unable to attend live, once again, you have that on-demand access right through our YouTube page. My colleague Kate will actually be placing in the Q&A a link to that page if you are interested in accessing, once again, any of those on-demand workshops. Another housekeeping item that I do want to call out is that all of our participants' microphones and cameras are automatically disabled. There will be time at the end for questions with Bill, so if you do have any questions throughout any point during today's webinar, please feel free to enter them into the Q&A feature in the Teams webinar. So at the top of your webinar, you should have a Q&A icon where once again, you can enter any questions that you may have at any point throughout the webinar, and we'll get to them at the end. And the last and most important note that I do want to cover as part of the housekeeping items here is that the content covered here today is really meant to be educational in purpose. So if you do have any specific health related question or concern, we do recommend that you connect with your primary care provider. Or if you do have any benefit specific related question or concern, we do recommend that you call the customer care number that's located on the back of your health insurance card. All right, so with the housekeeping items out of the way, let's go ahead and learn a little bit more about today's guest speaker. I have the pleasure of introducing Bill Sheehan, who is one of our physical therapists, part of our care management team here at the Health Plan. Bill has a doctorate in physical therapy, a master's in health and human performance, and a bachelor's in health services. He has been a practicing physical therapist for over 10 years and started his career as a traveling physical therapist in Virginia before he then worked at an outpatient clinic, which he was the assistant facility manager. He then started his career here with the health plan in 2018 in the utilization management area, doing utilization reviews for physical therapy before transitioning to where he is now as part of that case management team in December of 2023. So Bill and his wife Amanda currently reside in Buffalo with their 3-year-old daughter, as well as their 2 golden retrievers. And in his personal and spare time, he enjoys camping, fishing, and working out, which really goes hand in hand with our topic here today on movement of the body. So Bill, we are so thrilled to have you here with us today. I will turn the stage over to you.
Thank you so much for that introduction. And thank you to everyone that's joined this webinar today. I want to just start out by pointing out some of the agenda items. Today, we're going to touch base on the musculoskeletal system and injury prevention, give you some statistics with spine and back health. I'll give you some tips for posture, ergonomics, and body positioning, as well as at the end, just kind of benefits of stretching and a list of provided stretches that that you can see video format on with a QR code that will be posted as well. And then after that, I'll pass it back to Katie to go over some related benefits and resources. All right, so before we get into the agenda, I wanted to start out with a little icebreaker, take a quick poll just to kind of lead us into those topics. So, what will happen first? There's going to be two poll questions. You'll just select and hit submit, and then we'll kind of get a running tally of, like where everyone answers. So, first poll question: on average, how many muscles are there in the human body? So, do you think there's 200, 400, 500, or over 600? So again, you'll just go ahead and select that and then hit submit. And I'll give everyone just about a minute or so to answer, just so we can get a good amount of responses. All right, so the leading one so far is over 600. Got 64 responses. All right, so it looks like we're slowing down. So yeah, so leading answer was over 600. So yes, for that one, it is over 600 in the human body. Now, there are actually roughly 30 muscles in each hand and each foot. So together right there, that's already 120 muscles. So yes, we have well over 100 or 600 muscles on the human body. Now, for the second poll question, it'll kind of be more personal to you. Have you ever experienced any type or any of the following MSK aches or pains? In this one, you can select more than one before hitting submit. So anything you've ever dealt with within your life. I personally have probably dealt with half of these. So we'll just kind of see where that ends up at the end of everyone submitting. Give you about a minute or so, just for adequate amount of responses. All right, so far, looks like back pain is the leading one, followed by neck pain, and then some plantar fasciitis. All right. So yeah, so it looks like, majority, well, a lot of us have dealt with some kind of MSK ache or pain, whether it's back pain, neck pain, and that's actually on par with the commonality between those types of MSK issues. Back pain, generally the leading one. Within the clinic, it's probably the most frequent thing I saw patients for. But yeah, so just wanted to start off with that just to kind of lead us into our topics. So thank you for everyone who participated. All right, so let's get into some musculoskeletal health. So, what is the musculoskeletal system? Well, it's the body's support structure. It's made up of bones, muscles, cartilage, ligaments, tendons, and joints. Now, the skeletal system has several jobs, some of which are easier to see and feel than others, but they're all important to your body and health. Your skeletal system's major functions include giving your body shape, helping you move, protecting your organs, creating new blood cells, and storing minerals. So your skeleton supports the weight of your body. It's also the anchor for all the tissue that connects to it. Your joints, connective tissue, and muscles all work together to push and pull parts of your body every time you move. The human skeleton is like a built-in suit of armor for organs throughout your body. Your skull protects your brain, your ribs shield your heart and lungs, and the vertebrae in your spine keep your spinal cord safe. Bone marrow at the center of some of your bones produce new red blood cells and white blood cells your body needs to stay healthy. And your bones hold your body's supply of important minerals like calcium and vitamin D. All right, so some MSK conditions. So MSK conditions can cause pain that affects your bones, joints, ligaments, muscles, and tendons. Almost everyone experiences MSK pain at some point, and the risk increases with age. So even by that poll that we started out with, you can see that everyone's dealt with some kind of ache and pain throughout their life. It's normal. You may experience pain or discomfort, stiffness, sleep disturbances, and/or mental health problems. And this pain can limit your mobility, range of motion, and overall quality of life. All right, so next we're going to talk about some musculoskeletal injuries in a little bit more detail. So believe it or not, the majority of MSK injuries are the result of a strain or a sprain. Now, a strain is an injury to the muscle or tendon, which is what attaches the muscle to the bone. A muscle strain is an overstretching or partial tearing of muscle fibers. Now, common symptoms of a muscle strain include pain, swelling, muscle spasms, and limited range of motion. The severity of the symptoms can be varied based on grade of the strain. Now, that can be categorized into grades 1, 2, or 3, or mild, moderate, and severe. Now, a grade 1 strain involves a few muscle fibers being stretched or slightly torn, whereas a grade 2 strain involves partial tearing of the muscle fibers, and a grade 3 represents a complete tear of the muscle or full thickness tear. Now, a sprain is an injury to a ligament, and a ligament is a piece of connective tissue that connects bone to bone. A sprain is a stretching or tearing of ligaments, and like strains can be varied based on severity. So, same categories of grade 1, 2, 3, mild, moderate, severe. Grade 1 is slight stretching and some damage to the fibers of the ligament. Grade 2, partial tearing of the ligament, causing prolonged pain and swelling. And a grade 3, or severe, a complete tear of the ligament leading to significant instability. Now, for me personally, I have dealt with plenty of ankle sprains throughout my life. When I was younger, playing different sports like football and soccer, I constantly kept spraining my ankle to the point where my mother stopped believing that I was actually injured until later when I broke my ankle and an x-ray showed that there were a lot of stress fractures that had healed over time. So I think she felt a little bad after the fact, but just showing that it is something that's very common and does occur a lot through sports and just in general. The most common sprained ligament in the ankle is actually the anterior talofib ligament, or ATFL, and that's usually due to an inversion or if you roll your ankle, and that accounts for 85% of all ankle sprains. Now, an overuse injury occurs when tissue is damaged due to repetitive demand over a period of time. So, an example of an overuse injury is rotator cuff tendonitis, Achilles tendonitis, tennis or golfer's elbow, shin splints, or the term runner's knee, also known as patellar femoral syndrome. Those are all types of overuse injuries. Now, musculoskeletal injuries can occur for a variety of reasons and can be classified based on severity, as previously stated, but they can also be characterized or categorized based on when the injury occurred. And that would be acute, subacute, and chronic. Now, acute is often defined as lasting less than 4 weeks. Subacute is between 4 to 12 weeks. And then chronic, which often means that the pain's lasting more than 12 weeks and or is reoccurring over time. I do want to just note that treatment can sometimes be dictated by how long since that injury occurred. So, like as a PT, if someone has a very acute injury, there might just be a lot of swelling that we would have to kind of manage first before jumping into strengthening and other activities. All right, so next, let's just discuss some facts and statistics when it comes to your back and spine. Low back pain is the most common musculoskeletal problem globally and is one of the most common reasons for missed work. So again, kind of leading back to that opening poll question or the second one, you can see that even in this small sample size, that was the leading one that's most people have dealt with within their life. Um, in fact, back pain is only second most common reason for visits to the doctor's office, outnumbered only by upper respiratory infections. So 8 out of 10 adults suffer from back pain at some point in their life. 1/2 of all working Americans admit to having back pain symptoms each year. Most cases of back pain are mechanical or non-organic in nature, meaning they're not caused by a serious condition such as inflammatory arthritis, infection, fracture, or cancer. 9 in 10, or 9 out of 10, acute low back pain causes end within 6 weeks. And then finally, the spine is excellent memory, and such, it's recommended that you take care of it to provide it and properly support it from a young age. Controlling your posture, engaging and strengthening, as well as stretching are all beneficial to long-term health of your spine. All right, next, I wanted to give you some ideas on how you may be able to prevent these MSK injuries. Um, like firstly, I don't skip warm-ups and stretching. Stretching improves flexibility and allows you to perform daily activities more easily. Before you start an activity, warm up with dynamic stretching. Dynamic stretching mimics the movement of the activity you're about to start and gets your muscles ready for movement. After your activity, make sure to statically stretch. Static stretching is when you get into a stretch position and hold it for a specific period of time, and that can improve flexibility and range of motion. Now, I think normally when someone says you should stretch more, they think more of the static stretching. But if you static stretch, you're holding a stretch position that actually inhibits or turns off your muscle. So if you're doing that before you run, you're putting your muscles at a disadvantage. Now, you should also prioritize strength training as you age. Strength training can build and maintain muscle mass, which will stabilize your bones, joints, and spine. It can also play a role in slowing bone loss, decreasing the risk of injury. Additionally, core strengthening and balance exercises will improve stability, allowing for increased mobility. Next, practice mindful movement and ergonomics. Pay close attention to how you move during your daily activities. Whether you're reaching, bending, or twisting, move with intention to avoid straining muscles or joints. For example, if you are lifting a heavy object, use the strength of your legs to slowly lift the object to reduce the strain on your back. If you work at a chair or a desk, choose a chair that supports your spine. Keep your screen at about arm's length away and keep your feet flat on the floor, slightly under your chair. And then lastly, practice good posture. Having good posture can help you avoid common aches and pains in your back, neck, and shoulders. Maintaining healthy posture can reduce wear and tear on your joints, especially in your neck and back. And although good posture may not be able to completely prevent joint issues like arthritis, it can reduce stress on your joints and help alleviate common symptoms such as upper back or neck pain or stiffness, headaches, and more. All right, next we'll go through improving some MSK health with posture, ergonomic tips, and additional considerations. All right, so what is posture? Posture is the natural way you hold your body. Your musculoskeletal system maintains your posture. All right, so now that we know what it is, why is it important to have good posture? Now, having good posture can help you avoid common aches and pains in your back, neck, and shoulders, as previously stated. And maintaining healthy posture can reduce wear and tear on your joints, especially in your spine. And although you can't completely prevent joint issues like arthritis, it can reduce the stress on those joints. And I just wanted to point out that sitting hunched actually puts about 200 pounds of pressure on your lumbar spine or your low back. And because slouching puts pressure on the bladder, poor posture can lead to urinary incontinence when one sneezes or coughs. All right. Now that we know some benefits of good posture and some issues we may experience with poor posture, I wanted to share some tips to encourage better sitting and standing posture. Now, firstly, with sitting posture, you want to sit in an upright chair that supports your spine, helps with your keep your knees level with or higher than your hips. Keep your ears, shoulders, and hips in a vertical line. Try not to cross your legs. And I know there are some chairs that have lumbar support built in, but if not, you can have a rolled towel, put it right in your low back. That'll support your low back, your lumbar spine, and help with the natural curve of your spine. I also encourage my staff to, stretch and walk around after about 30 minutes of sitting. Obviously, that's not always possible, but it's something to good just to get up and walk away before coming back. Now, it's not expected that someone will have perfect posture all of the time. However, it's good to just be mindful of what good posture is. Now, for me, with patients, or even myself. I can use, like, I'll use a mirror just for visual feedback. Because sometimes it's just hard to tell if you have proper posture. You might know what it is, but you don't necessarily know what it feels like, or especially if you're not doing it correctly. I think people naturally fall into that slouch position. So if you could just be more mindful of it, sitting up nice and tall, keeping your shoulders down and back, activating your mid and low trap, it'll help support your scapula and your spine as well. In fact, when I started here at Excellus, I went from the clinic from standing most of the day to sitting majority of the day, and developed severe neck pain probably within 2 months, essentially just not listening to my own advice. However, just with, you know, being mindful again of it, of course, it took until I started developing pain to be more mindful of it, and doing more exercises, which some of which will be later shown. I'll be able to show at least one that helped me a lot, especially just with my neck pain. And then here are some tips for standing posture. So stand up straight and tall. Keep your shoulders back. Again, activating your mid and low trap muscles, trying to not use or shrug, trying to not use your upper traps as much. Try to put your weight on the balls of your feet rather than on your heels. And then you could also put one foot on a low box or stool and switch your feet every few minutes. That'll just help go back and forth between how much weight is on one side of your body versus the other. All right, next I wanted to share some tips for physical movements and activities that we do throughout the normal day. Let's start with proper lifting mechanics. And that could be just picking up kids, a laundry basket, pretty much lifting anything. Now, this is actually something I would have one of my patients do before I discharge them, especially with any kind of back pain. I would go over proper lifting mechanics, have them show me correctly how to do it multiple times. Just to prevent reduce the risk of or further injury. Now, with lifting, you want to get close to the object. The first thing I have with like any of these is to try to check the weight to make sure it's something that you're going to be able to do by yourself. But when in doubt, ask for help. Get some assistance if you're not sure. You're going to stand feet shoulder width apart. Again, shoulders down and back, engaging your mid and low trap muscles. You're going to bend at the knees and use your legs to do the work, not your back. And you should not lift and twist in one motion. That puts a lot of stress on your spine. Just use your feet to move once you have the object close to your body. Again, elbows bent. You also want to make sure that the force in which you move is smooth and consistent. You shouldn't be having a jerking motion. Now let's talk about tasks that involve pushing or pulling. And this could involve a grocery cart, a baby stroller, or even a lawnmower. Now, you should always, if you're able to, you should always push an item opposed to pull when possible, as pushing position places your back in a more mechanically safe position. Now, obviously, that's not always going to be practical, but when it is, push rather than pull. Now, some tips: place your shoulders down and back, again, engaging those mid and low trap muscles. Again, before you want to check the weight just to make sure that, it's something you can do by yourself unless you need help. Same concept with apply a force that is smooth and consistent, avoiding that jerking motion. And then finally, let's talk about carrying items. And then again, that could be grocery bags or a child. When carrying items such as grocery bags into the car, make sure you keep the bags close to your body in the safe zone. Have your elbows bent as to engage your biceps and help disperse the load from your shoulders directly. And the same thing as lifting, try not to twist, try to use your feet to move, just to avoid placing extra stress on your lumbar spine, or your spine in general. All right, so here are some tips to help reduce injuries and improve MSK health for sleep, footwear, and accessories. I want to start with sleep positions, but I do want to say that if you sleep soundly and wake up without pain or stiffness, then whatever however you're sleeping is working for you. So no need to change anything. These are just tips in general if someone is having pain. Um, so if you're a side sleeper, consider putting a pillow between your knees. For the back sleepers out there, you can slightly elevate your legs by placing a pillow under the knees and calves. Stomach sleepers like myself actually causes the most stress typically, but if it's preferred, you can always put a pillow under your hips. And again, I just want to reiterate, if you sound sleepy or sleep soundly and wake up without pain or stiffness, then whatever you're doing is working fine. For mattresses, medium firm usually is best, but everyone is different, so just listen to your body. And I think that goes along with like anything. I always tell people, you know your body the best. You just listen to it, um, and then make sure you flip or turn the mattress every couple months. All right, for shoes and footwear, what you wear on your feet can have a big impact on your back. So try to limit high heels and flip-flops or flats without any arch support, as this can lead to mechanical issues of the foot and ankle. Having cushion inserts and soles is always best, and I want to recommend a transitional period for any type of new sneaker or increased activity. And if you're standing often, having an ergonomic cushioned mat and or slightly putting a foot at elevation through either a step or a box can help alleviate back pain. High heels change your spine's mechanics and can trigger foot, leg, back, or even neck pain. Also, you're more apt to trip, fall, and or roll your ankle. And hard to believe, but your accessories such as a purse or wallet can have an impact on your back as well. So if wearing a purse, make sure to clean it out. You don't need 5 to 10 pounds in your purse. Try to keep it light. Cross-body purses are preferred to disperse the weight among the shoulders and upper traps. But if you use a single strap purse, try switching shoulders frequently. And then for wallet, similarly, you want to clean it out, try to keep it thin, switch between each pocket, whether it's front or back, side to side, just so you're not constantly reaching in the same direction, causing an overuse injury. Um, and if you're sitting on one side that's bulky, you end up sitting crooked, and that can create more stress on a certain side of the spine too. And also just want to throw in there, when using a phone, obviously having a headset is probably most preferred. If you have a job or you are constantly on the phone and you're constantly one side, it can create more stress on one side of the neck. So try to alternate back and forth as well. All right. Next, let's talk about a few common terms that I'm sure most of you have heard, and that's mobility and flexibility. Now, mobility refers to the ability to take your body through a range of motion before being restricted with control and is dynamic. Mobility is essential to our overall quality of life, especially as we get older, because it's really your ability to move and comfortably perform daily activities without restriction or pain. While flexibility refers to the ability of your connective tissues, such as your muscles, ligaments, and tendons, to temporarily elongate. Flexibility is also important because your body is restricted. You're unable to move through your natural range of motion, and then pain can occur because of that. Now, both mobility and flexibility are very important and require active participation by you in your life to keep these at a good range. One of the best ways to keep your mobility and flexibility is through active stretching and dynamic movements of your body parts. I like to refer to the phrase, if you don't use it, you lose it. All right. This is just a list, and this isn't an extensive list of all the benefits of stretching, just a snippet. But stretching can reduce the risk of injury, improves range of motion, it can be a stress relief, improves posture. And then, like I said before, dynamic stretching before physical activity can help prepare your muscles. Now, I'll hold on this slide for about a minute or so. If you scan this QR code, it will bring you to a spot to view all of these exercises that are listed in a video format. Um, most of these exercises can be turned into dynamic stretches. However, I wanted to be consistent when they were being filmed, so I chose to do all static stretches and exercises that mostly don't require any equipment. Now, the one I had talked about earlier that helped me personally with neck pain when starting at a position that required a lot of sitting um, was the chin tuck exercise, also called the cervical retraction exercise. Some may say it's not really a stretch, although there is some stretching involved, but I think it's a great exercise just in general. So the chin tuck requires, I'll just turn sideways for a second, to essentially make a double chin. You don't want to look down, you look straight ahead and you draw your chin straight back, and then you hold for 6 to 10 seconds, pretty much whatever you would like at that point. This is working the deep cervical flexors, but it's also stretching the posterior aspect of your neck. Now this is a great exercise, not only for to do because it's good for posture, but you can do it in so many different ways and settings. You can do it in sitting, standing, laying on your back. You can do it up against the wall for tactile feedback to make sure that you're pushing straight into the back, into the wall. I do this at stoplights because I have the headrest behind me that I can push straight back into. Again, it's a great postural one, but it also stretches the back of your neck. And then again, there will be a link, I believe, posted in the chat too, if you weren't unable to grab that QR code. All right, and then wrapping up. So just a few things I want everyone to take away from this presentation. You should be proactive, not reactive. Prevention is key. Be mindful of your posture and body positioning when performing everyday tasks, as this can help reduce the risk of injury. Incorporate regular movement throughout the day. And then I love this. What is the single most effective exercise you can do to help reduce the likelihood of back pain? Really, any type of pain, it's the one you actually do. And with that said, I'm going to pass it back over to Katie.
Awesome. Thank you so much, Bill. That was so much great information and just your knowledge, expertise that was shared. So we appreciate you taking the time to really review that with us. As I mentioned, if anyone does have any questions relative to any of the information Bill covered, please feel free to plop them in the Q&A at the top icon of your webinar. And once we get through the related benefits here, we will open it up for any questions that have come through within that Q&A. So that being said, the next few minutes, I am going to provide a very high level overview of some related benefits, tools, and resources that you as an Excellus member may have available to you. I do want to call out that the availability of these benefits, tools, and programs do vary by contract. So, to either learn more, confirm benefit eligibility, we recommend either logging in to your Excellus online account or once again calling that customer care number on the back of your health insurance card. But with that being said, the first program that I wanted to provide an overview on is Vori Health. So, Vori Health is our partnership that Excellus has entered into, and it is providing our members a virtual physical therapy option for musculoskeletal health. So, Vori Health works with our members by designing a treatment plan around you specifically. They will have an hour-long initial video visit consultation with Vori Health doctors and physical therapists that really specialize in muscle and joint conditions. So you will then receive a personalized at-home virtual treatment plan that can include physical therapy exercises, nutrition counseling, overall healthy lifestyle coaching, and more. So, of course, as Bill mentioned, if you are experiencing any musculoskeletal aches or pains, we of course recommend to be connecting with your primary care provider or specialist on what treatment is available to you. But once again, the virtual option for physical therapy, if recommended, is a great benefit, to tap into if needed. I myself, as a mother to young children, find it hard to go in person. Physical therapy may be multiple times per week. It could be a time commitment. So, having that virtual option, if it is a good fit, once again, is just something to be aware of and potentially utilize. Next up, I want to mention the Find a Doctor tool that is available on our Excellus website. So, this is a tool where you can go to find in network providers. And within the tool, there is a search feature. So, if you are looking for maybe a physical therapist or a chiropractor, something relative to a musculoskeletal ache or pain, once again, that Find a Doctor tool allows you to search for in network doctors, specialists, and more. You're able to filter those results to the type of specialist, whether the provider has different languages they speak, if they're accepting new patients, and more. And then also part of that tool, there is an estimator cost tool calculator available. So for any of our members that are potentially on a high deductible health plan, having this cost estimator tool to potentially know what out of pocket expenses are relative to your plan can be very helpful and insightful. So we do recommend being logged into your Excellus online account to make those specific to your plan. But once again, great tools to utilize to be more informed about the type of care you are looking for specific to musculoskeletal. Up next, our care management teams. So Excellus has a care management team that is inclusive of a variety of healthcare professionals, such as registered nurses, registered dietitians, physical therapists here, such as Bill. And this team is really here for our members from little health questions to big health challenges and or concerns. We are here to support our members of all ages at no added cost. So you can engage with this team for, once again, maybe small questions, or if you are maybe dealing with chronic multiple comorbidities and looking for support. The team is available through phone call, as you can see here on this slide, or another great way to engage with that team is through the free WellFrame app, which can be downloaded to create your WellFrame account. And through that WellFrame app, you have direct connection once again to our care management team, as there is a text feature through that app where you have once again direct access that is convenient, flexible for you as a member to get that support. You can see some of the common conditions and or concerns that our member care management team can help with, such as diabetes, high blood pressure, weight loss, stress management. So once again, if interested in engaging with that care management team, specifically through WellFrame, there is an access code when setting up your account, and that is Excellus Welcome, all one word, all lowercase. Next up, Blue 365. For any member that is not aware, you have access to an exclusive online marketplace where you can access deals and discounts on a variety of health and wellness related products and services. So things such as fitness or workout gear or apparel, meal delivery services, gym membership deals. Once again, a lot of great top brands, hot deals available to you, whether that is nutrition related, fitness related, hearing or vision, and more. So, wanted to highlight once again some great gym membership programs available through there, such as Fitness Your Way or Active and Fit Direct. So, definitely check out blue365deals.com or through that online account to learn more about those options. And last but not least, wanted to quickly touch on Thrive Well, which is a program, once again, available to certain members that have it available through our partnership with Personify Health. And through this well-being platform, our members are able to engage in healthy behaviors, hopefully to really help lead that healthier lifestyle overall. So you take a health risk assessment through that platform. And maybe if you are interested in musculoskeletal health, they have some great challenges or journeys to participate in to get that movement, get that stretching in like Bill recommended. So once again, this one does benefit, availability does benefit by contract. So once again, be sure to check it out if interested and available to you. So with that being said, a lot of information we just covered. I do want to open it up for questions that have come through. So I will go into that Q&A once again for anyone that has not had a chance. Please go into and enter any. So Bill, first question that has come through. In terms of footwear, is there any recommended cadence to changing footwear, i.e. using different dress shoes for those of us in office? And how do we know when shoes sneakers are worn out? Any thoughts around that?
Yeah, so I think it has less to do with like cadence and term. It's more about like how often like you're actually on your feet. Like shoes can be like old, but if they're not really worn, that's one thing. I think it's more important to make sure that you have proper inserts or soles like within the shoes. I personally have worked with places like Runner's Roost and Fleet Feet that are really good at taking looks at taking a look at your feet and your shoes specifically. They'll look at wear pattern. Obviously, PTs can do the same. Um, Normally, once it really depends on the specific shoe too, whether it's they can always look to see if it's like the proper one for you. But in terms of cadence, I mean, like with running, like shoes can last for like 400 miles, but when you're just walking, it's better just to have really good inserts or soles.
Awesome. Great. Good to know. Thank you. Next question. Do you have any recommendations for how to choose a pillow for side or back sleepers?
All right, so I don't have any specific recommendations in terms of brands or anything like that because I think everyone's so um, specific and how they sleep. It's more of a trial and error. Although I know some PTs, if you go in, they have different types of pillows that you can trial while you're there. But really, you just want one that's going to help support your neck, so that it's in proper alignment. So you're not like tilted one side or the other side. I think that's probably the biggest recommendation I can give.
Awesome. Thank you. Next question I feel like is very common for anyone that probably joined here today, but just as you age, you get more aches and pains, right? How can you tell if it's actually something wrong versus maybe more of just the normal stiffness of aging?
Well, you could go to your PCP or see a PT. They'll be able to tell you. But I would say if it's starting to affect your normal daily activities, it might be a good idea to go in and see someone to have a better evaluation.
Awesome. All right, next comment question. This person has struggled for 8 weeks with shoulder pain. X-ray did not show any broken bones. Is there any other test that can be done, or should they look to go to physical therapy, would you say?
Well, as a PT, I'm definitely going to tell you to go to PT. That's usually the first conservative type treatment that you would want to try. A lot of we're movement specialists, so they'll be able to see how you're moving, if you're compensating. And there's a lot of special tests we can do as PTs to determine if it's something muscular in nature, which might be why it didn't show up on an x ray. Um, but I personally would probably tell you to go see a PT.
All right, and then maybe one of the last one or two to get through just based on interest of time. If somebody is experiencing back, hip, or knee pain, do you recommend that they stop activity or try to work through it?
Ooh, I get this one a lot, especially from my wife. So I think it really depends on the type of pain. I say sharp shooting pain is generally no good. Your body's telling you something's going on. You should generally not push through pain. There is something called DOMS or delayed onset of muscle soreness. Could be from something you did a couple days before that now you're sore. Generally, if it's a pain that goes away and with stopped activity, I would just monitor to see what else kind of brings on that pain. Sharp shooting pain generally no good. Dull aching, keep an eye on. But as always, if you're concerned, certainly a good idea to go see your primary or a PT that can really do a thorough and evaluation.
Wonderful. Awesome, Bill. Well, once again, thank you for your time, your expertise here today. We appreciated it. And everyone, once again, attending, some great questions asked there. So before we wrap here, just wanted to give a gentle plug for our next well-being webinar that we are hosting in July. This one on the topic of the miracle of movement. So I myself actually will be the host and facilitator for next month's webinar with my background in athletic training and personal training. So I'll be discussing the importance of physical activity, recommendations for it, kind of the basics for resistance and strength training and more. So on the slide here, we do have a QR code. If you have not already had the chance to register, feel free to scan that. My colleague Kate, once again, is going to put the actual link to that registration page as well in the Q&A, so feel free to grab it there as well. But that will be Thursday, July 24th, 12 o'clock as well. We hope to see you there. So with that being said, Bill, once again, thank you for your time. Everyone, thank you for attending here today. The recording will be placed on our Excellus YouTube page, typically within 1 week of the live webinar, so feel free to access there. And once again, hope to see you at next month's webinar. Hope everyone has a wonderful day.
Thanks everyone for joining.